Myloreal here with Tab Training Academy. I'm standing here with Dr. Brian out of Louisiana. We're going to talk about his standard level bags, but we're going to talk about the biggest one in that level, the Charles Drew bag.
Correct.
Let us viewers know about this bag, because this is one of my best sellers, actually, you guys. It has a lot of things in it. Can you break this bag down for us?
Absolutely, be my pleasure. So with this bag, Charles Drew, named in honor of Charles Drew, who was the father of blood banking for the American Red Cross and the United Kingdom during World War II. He pioneered all the blood banking, to be able to save blood, to be able to transfuse. He was the guy. He came back and ran all the programs for American Red Cross until they refused to acquiesce and let African Americans be transfused. And he quit and then went to Howard Medical School, where he became the first African American to be recognized by the American College of Surgeons.
Wow.
So very, very, very huge guy in the medical.
As you're unpacking it for our viewers, how did you come up with these names? Like, they're very unique, and I've never really heard of that. And I know you're a unique person, okay? And I always pleasure doing videos with you and content and just having our partnership here. Can you tell our viewers why the names? Like, why?
Yeah, I didn't want to just have your standard, oh, I've got IFAKs. I wanted to honor African Americans who were pioneers in their field. And me being a physician, I chose 3 dynamic physicians who paved the way. I stand on their shoulders, and that's why I named it in honor of them. Okay? Again, Charles Drew. In this bag, you're going to get multiple triangular bandages, at least 2 to 3. You're going to get a 24-inch SAM splint, right, for broken bones. You're going to get a 6-inch emergency trauma dressing that can be used as a compression bandage or to pack wounds. You're going to get multiple 4-inch gauze, again, to pack wounds as also to wrap wounds. You'll get a nasal trumpet, right? A nasal trumpet is a nasopharyngeal airway is the common name for it, and that helps with any trauma to the face where you need to secure the airway. You're going to get a Cat 7 tourniquet or the like. It could be a soft T, it could be a Recon Medical. You're going to get tape, again, another 4-inch roll, and these 2 6-inch bolts along with 2 keys to make your improvised tourniquets out of these triangular bandages. Okay? Trauma shears, you get with every pack. In the back of the pack is where you have a 36-inch SAM splint. So you get another SAM splint in this one. You also have Celox. You're going to get 2 packs, either a Celox granule or a 4-inch Celox impregnated Z-fold bandage. Again, this is anti-hemorrhagic, made from the shells of crustacean, standard all over the world. They use this in trauma back to Desert Storm. That's where all this started. In the anterior part of your package, you got another 4-inch bandage, some nitrile gloves. We always use nitrile. We never use latex because a lot of folks are allergic to latex and they don't even realize they are. Yeah. You get a 4-inch duct tape. You get a CPR mask, disposable, one-time use. Mylar bandages, Mylar blankets to prevent hypothermia. Hypothermia is a killer, especially when you're in low blood volume. You get a hand warmer to help also keep you from being hypothermic. Another 4-inch dressing and ETD dressing, along with your pen. The pen is going to be very important to write the time, date, and stamp on your tourniquet, your commercial tourniquets. So this bag's a little bigger, more aimed at controlling major hemorrhage. Major hemorrhage can come from anywhere, guys. We're not talking just gunshot wounds. We're not just talking about knife wounds. We're talking about falls from height. We're talking about motor vehicle accidents, pedestrians being hit by motor vehicles, or like I say, falls from motorcycles. So those are the things that we want to implement. All with this bag won't help save you unless you get the skill set to go along with it. So make sure you get some training from somebody who's certified and knows what they're doing, okay? These bags are dated for 3 years as far as expiration dates. When you package these things, that does not decrease their warranty, nor does it decrease their expiration date. But what will is if you use this one time, it is a one-time use, guys.
What he's not telling you guys, just to make sure that we're clear, he's not telling you guys if you unpackage everything that comes in here, that they will not mess with the expiration date. He's really talking about this tourniquet right now, okay? You guys Correct. I just want to make sure that
Correct.
we're nice and
Absolutely.
clear before this. Well, he said that we can open up anything, and 3 years from now we can still use it.
So we're
We don't
not
want that problem, right?
No, we're
Okay.
not going
All
to
right.
open up our ETD dressings. We're not going to open up any of our bandages until crunch time comes and we need to use them. But you always want to pre-stage your tourniquets. Your commercial tourniquets need to be pre-staged. When you pull them out of this
It'll look like
packaging,
this after you guys
it should look
take it,
like
yes.
this. Properly pre-staged, you're going to dog ear your time date stamp, and you're going to make sure you fold it back on itself to where the red tip is pointing up. Okay, we'll do another video separate from this. And any questions you guys have, please shoot me some information. I'm on Instagram at TechMed, at Noir Armory. I'm on Facebook as Noir Armory as well, and also YouTube, Noir Armory Medical TV. Our website is noirarmory.com. And again, my name is Dr. Brian Despinas, and we appreciate your attention to this.